welcome to Westlake Dermatology's live Instagram feed. And I am Dr. Heidi Prather. I practice at our main Bee Caves location and am a dermatologist, board certified, also fellowship trained in cosmetic surgery and lasers. And I'm really excited because we're going to be talking about a subject that's very near and dear to me, but skin tightening treatments and what this means at home if we're still kind of really minding our safety standards. But fortunately here in Texas, we have been able to emerge some and really kind of get back to a little bit of normalcy here. And some of the skin tightening treatments that we offer in office we'll touch on as well. But I think these subjects are very interweaved, and what you do at home certainly reflects how you maintain and the results you get when you go into the office for other treatments. I will be having Dr. Geddes-Bruce, who is a fabulous colleague of mine at the Westlake office. She recently started a new branch for us at the Far West office. So I'm just looking for her to pop up so that we can kind of engage her in this conversation as well. Let me search for her. We'll also be taking questions. So if you have any questions, I think I'm going to give her a moment to join. But if you have any questions throughout the talk, anything that you're dying to know about skin treatments at home or in office, please let us know. And what I really want to do is kind of start with talking a little bit of the background with skin tightening. Skin tightening really starts with elastin and collagen in the skin. And as we age, those tend to break down. So anything we can do to preserve elastin and collagen and boost elastin and collagen will really help preserve that turgor and that just softness and glow in our skin. Things that I personally like and recommend to my patients. And here we have Dr. Geddes-Bruce joined. So let me add her real quick so she can chime in with some of her favorite treatments as well. Okay. And let me try one more time. Perfect. Okay. So she will be joining us in a second. But to get back to skin tightening and elastin collagen. Hi, Dr. Geddes-Bruce. How are you?
I'm good. Thank you. Sorry for the little mishap there. But I'm
no
glad I
worries.
could join.
It's amazing how busy everyone is staying, even with at-home orders and shelter in place. And so despite not being in the office and missing all of my fabulous patients and colleagues, I feel like I've been quite busy over the past 2 months. How about you?
Yeah, absolutely. I've done a lot of organizing my closet over and over. A lot of home care, taking after the boys, really props to all the stay-at-home moms out there that no one really appreciated how much they had to do until they were in that role themselves, homeschooling and things like that. So, but I'm back in the office now. I've been back for 2 days, and it's been a little bit challenging even readjusting to that, but it's nice to get back and see patients.
Well, I think one thing that everyone wants to know is, first, tell me about the office that you're at, because that's kind of one of our coveted new locations. And I think it's incredibly cool that you're not only merging the medical aspect of dermatology, but also the aesthetic nuances at that office. You have so many great things that you feature there and are such an asset. So where is the office located, and how are you liking the new build?
Yes, thank you. So we are one of the newest locations on Far West Boulevard. It's sort of north central Austin, and it's right near Starbucks. So you can go in, get a latte, then come over and see us. And we offer full spectrum, so medical dermatology as well as different cosmetic treatments. I do smart lipo there. We have the radiofrequency microneedling with the Genius RF, which I know is one of your favorite devices and we'll be talking about today. And we have a V treat redness and we have, we do a lot of chemical peels and cool sculpting. We kind of have everything.
Oh, that's amazing. Well, we will definitely dig into some of your favorite devices in the office, but I wanted to start first with skincare because I think I don't know what you tell your patients, but I think skincare is such a big tenet to the foundation of how we nurture our skin and really promotes how our skin is going to respond and heal when we start doing more intense procedures in the office. I always think of it a little bit like a garden. The biggest difference is gardens need sun, and obviously sun is something that can damage our skin, so we have to protect ourselves from it. But other than that, you know, when you think about a garden, you're going to prep that soil, you're going to feed the plants and really add in a lot of nutrition. And you're not really going to stop there, but you're going to continue and cultivate those plants depending on what you're growing, and aerate the soil and make sure that everything is maintained. And similarly, I think starting with a really good skincare plan with the right antioxidants, the right primers, the right moisturizer will really set that tone for your treatment. And then, of course, being very cognizant of what is safe for you post-procedure wise. I know I have a couple of my favorites that we're going to touch on today, too. What is your stance on skincare?
Oh, I completely agree with what you're saying. 100%. And I love that analogy. Maybe I'll try to use that with my patients. You know, everything we do works better in combination. When you do your treatments, if you have your at-home skincare, and then you come to the office and we perform different treatments using different devices, you're just going to get a better result when you do everything all together. So I completely agree. It's kind of the building blocks, the fundamentals. We've got to start with good skincare.
Well, let's dive right in. So I know I have been quarantining, so I've got my little travel bag that I keep all of the products that I use every day in. And I know one of my favorites that's new has been the Elastin product line. And I think it's really novel because it has this trihex peptide technology. And the peptides are really just meant to help with skin turnover. So I find them really essential, especially after any procedure that you do, because in order to stimulate new skin, new collagen, new elastin, we're actually creating a little bit of these minor injuries that turn these genes and these cascades on to help repair the skin. And when you bring in something that has this trihex technology, it's actually going to help the skin turn over faster, repair faster, and therefore have a lot less inflammation even in the skin. And so they have a lot of different products, but the Elastin Nectar that I'm holding here is pretty cool because it actually goes on almost like a gel. I should have kind of pumped it a little bit closer, but I'll do another little pump here so you can see. You can see just how kind of gel-like it is. And, you know, even if I just put it on here, you know, you're not really going to see any shine. It goes on really light, almost like a dimethicone primer.
Yes.
And that's because there is a ton of dimethicone in it, but the particles are really nice and large. So they're not going to actually absorb into the skin after invasive procedures that we're going to talk about, such as the Genius RF microneedling that you mentioned. So we don't have to worry about long-term allergies or contamination in the skin, and it's safe to use after procedures. It also has Arnica montana in it, which is kind of nice. So people who tend to be easy bruisers, I like to put it on beforehand and continue afterwards just to help protect the skin. But with this, because of the process of skin turnover, it's really going to enhance and support your skin's ability to create elastin and collagen in the skin. So that's, you know, the Elastin line I think is going to be a great source for that. And if you haven't tried their sunscreen, this is another must because it has small amounts of all this technology. But again, Dr. Geddes, I know you're going to agree with me on this one. If you were going to do one thing for your skin, what would it be?
Sunscreen.
Sunscreen.
Yeah.
So, Dr. Geddes, tell me a little bit about another product line. I don't want this to be biased towards one brand at all.
No,
I have no alliances or any payments or kickbacks or anything from Elastin. I don't work with them, but I just love to use their products personally. But Revision is such a phenomenal product line too, and they have a lot of technology for tightening. Tell me a little bit more about that.
Yeah, so I mean, I love Revision. I love Elastin. I think the products have roles, both of them. I wish I could put both on my skin all the time. Revision products are fantastic. I think Nectifirm is kind of the first one that everybody thinks about. It has a cult following. It's been around for a very long time, and people just buy it and buy it and buy it over again because they consistently see nice results from it. It's got, you know, again, peptides. It's got antioxidants. It's got nice moisturizing factors in it as well. So it's an all-in-one treatment that really helps tighten the skin. And Nectafirm specifically for this area along the jawline and underneath the submentum to help tighten it and give you a little bit more structure in this area, help the skin laxity there. Yeah, Nectafirm's a fantastic one.
If people are getting a skin tightening procedure on the neck with you, when do you tell them to start something like Nectafirm?
Oh, immediately, honestly. So if they're getting like cool sculpting, afterwards we have them massage at home while they're healing with Nectafirm. If they get Genius radiofrequency microneedling, we do wait about a day and have them start using products the next day. What about you? How long do you wait until after microneedling?
Yeah, after microneedling, I think I like to wait for any product that's not meant to be on open skin at least 6 hours, but it depends on how aggressive of a microneedling treatment that you're doing. But in general, microneedling is going to be less aggressive than something like CO2, more controlled skin injury, and therefore those pores should close within about 6 hours for the most part and help prevent any, preservatives or fragrance, anything that we're worried about absorbing into the skin from causing any, long-term or delayed allergies. And so usually 6 hours is what I tell patients, but most of the time, since we're putting on such great post-treatment care, I have them sleep in that and just wash their face in the morning like normal. So really kind of an overnight buffer. But it really just depends on the patient's schedule, the treatment technique, and what they're doing.
Yeah, I agree. I mean, most of the time I just tell them wait till the next day, the next morning, then resume stuff. Yeah.
Yeah. What do you think about vitamin C and antioxidants? I know this is a big thing, and it really kind of started off with L-ascorbic acid and SkinCeuticals really being the pioneer for making a high quality, high concentrate, and highly stable molecule, which is very difficult to do with vitamin C. And gave us CE ferulic as a serum. And then we have like the newer tetrahexadecyl technology, which is THD. And the biggest difference is it's not acidic, but it's still the same molecule. It just activates after absorption into the skin without that stingy, burny, acidic injury to the skin surface. And there's so many products and brands to sift through, which I think make it very challenging to pick a good one. It makes it even harder when the price points can just vary from one spectrum to the other. On one hand, you can get a beautiful vitamin C for $150 from company A, and then you see an ad on probably Instagram for a $15 vitamin C. What do you think about that, and how do you advise your patients in terms of picking the best antioxidant for them, and like that role in skin tightening for having a vitamin C on board?
Well, I definitely tell all my patients that if you're going to stick with like 3 products total, most important is sunscreen, second is a retinoid, third is vitamin C. That's kind of my mantra, and that's the way I try to advise patients. Agreed, vitamin C, you've got to pick a good quality one. I'm not saying that every vitamin C out there doesn't work, that you can't get a decent one from the drugstore, just that I don't have data to back that up, and so I can't recommend it to my patients if it might be oxidizing as soon as they open the bottle. I tell them it's kind of like when you cut an apple and it turns brown when it hits the air. That's what can happen to the vitamin C that you're applying to your skin, and it's actually not penetrating and getting any of the good effects. And the ones that we like to recommend, like the CE ferulic, like the vitamin C from Revision, those ones have good studies behind them, and we know that they work effectively. So that's usually why I back up those products.
Yes. I think that's a really good point. I love that you give the mantra of sunscreen, vitamin C, retinol. I do a similar thing because if you really think about like the 3 basics, you're giving people the tools to really take care of themselves, whether they choose, to buy from an Instagram shop or the department store or, a medical grade product. And I don't know, I guess I didn't realize how into analogies I was, but I was just thinking about listening to you talk made me think about vitamin C, almost like a cashmere sweater, because in the wintertime, I feel like it's the hottest, thing, the hottest item to buy. You're looking for that cashmere, but it's so hard to sometimes to find well-made cashmere that's actually very soft, durable, that's not going to break down and not going to get those little sweater balls. And half the time you find a sweater and you look closely at the tag, and even though it's been labeled as cashmere, it has wool, it has all these other things in it that may or may not be what you're desiring. And so I think the biggest difference when you invest in these, medical grade products that build in the research and are willing to invest in the quality ingredients, you really know what you're getting. And vitamin C's, I agree with you, are a huge part of making sure that we're boosting that collagen. It really binds directly to that pathway. And there's been some great studies. Jill Weibel out in Florida, I think, is just brilliant, very invested in wound healing and scars for patients. And she was one of the first who did, and I know you already know this, Dr. Geddes, but for our fabulous audience who's tuning in, but she was one of the first to really take and pair vitamin C with some of our laser treatments that we do and show that you get about a 15 to 16% increase in collagen when you're using the right products in the right setting. So I think when you're getting treatments, even if you don't want to do skincare ever, and sunscreen's the only thing you're willing to do, if you're ever going to do these other tenets of collagen boosting treatments for skincare, when you get your treatment in office is when you want to use it for those 3 months. But it can break down, so use it in the 3 months. Don't save it for 5 or 10 years, because your quality will probably degrade at some point. What's your favorite vitamin C? What did you use this morning?
I use C. Frulic. I'm still stuck on it. I think it works fantastic. I love the data behind it. I tell my patients that it smells a little bit like hot dogs. That's a little bit ridiculous because it kind of does, but it goes on nicely. It doesn't cause me any acne. I'm a little bit acne prone, and I know in some patients it can. The vitamin E component in it can sometimes cause a little bit of acne, but for me, it doesn't seem to cause that issue, and I love it.
Yeah, I think that's a good pearl that you just mentioned, is avoiding vitamin E in products if you're acne prone. My favorite is the Revision C Plus Correcting Complex. It utilizes that THD technology, so it's not acidic or burning when it goes on the skin. So it's great for people who have more sensitive skin. It's lotion based. It does have some vitamin E, but it actually has bakuchiol in it too. So that's actually going to work the opposite with acne and help calm down the inflammation from acne. And so I have found, even though this can be a little bit more hydrating, that it is mindful in acne prone patients. You can use it twice a day, but if you tend to have more oil, more sheen, you may want to just use it at night. But you can see it just kind of, I love these little demos. It just goes on like a nice little lotion, and rubs in very thin, very lightweight. I love this product too. Well, I think we're covering a lot of tenets here in terms of skin tightening, which is great. Do you have any other products that you're loving? I know Neocutis is another product on the market line, as well as SkinMedica, that really both have growth factors at the root of their technology. I do think there is a role for growth factors, especially for people who have more advanced skincare needs. It's probably not necessary in more youthful people who have more, quality skin, more turgid skin to begin with. But I think as our skin ages, all the mechanisms of repair start to break down, and anything we can do to help cellular communication can help enhance that repair mechanism. And I would say the two leaders in growth factors right now are probably Neocutis and SkinMedica. Am I leaving anybody out?
Oh, that's fantastic. That's about right. Yeah. TNS is just, again, that has its own cult following. And then Neocutis makes their own specific tightening creams, like I think it's NeoFirm now. It used to be MicroFirm. And patients love those too.
Yeah, there's so many to choose from. So Neocutis is great because they put a little bit of growth factor in everything they make, but their highest concentration is their BioSerum. And now they have the BioFirm. I happen to have this here too, because I've been trying it out. And
what do you think? I haven't tried it. What does it feel like?
It's nice because I tend to be more acne prone and oily. You can probably see from my cute little shine. I call it the dewy look. I think that's in, right? So it's a little bit thicker of a product. So you can see as it comes out, see how just lush that is. So it can be used a little bit as a light hydration. But even when you put it on, I'm just going to layer it on top of my sunscreen here. You can see that I'm not too shiny. It rubs right in. Feels awesome. So I've been using this on my face, neck, and chest twice a day. And then putting on my sunscreen over it without any heaviness or anything like that. But it's been really fantastic. Mm-hmm.
What's your go-to for body?
Oh, body is a tough one. So I love this partnership of Dr. Geddes and I. I've been checking the questions too, and I haven't seen that we've gotten any questions, but for all of those who are chiming in, if you have any questions about what to use or what treatments to get for skin tightening, feel free to comment, and I'm happy to answer it. And Dr. Geddes is getting these questions too, and so she is happy to answer it as well. But she just had her second baby boy, and I am pregnant with my first baby boy. And so skincare and body creams have been a conversation between the two of us frequently about whether or not we can really prevent stretch marks, especially with a growing baby. And just in nature, you know, can we prevent them in general by skincare? And I think that's a tough question to answer. There's probably a large genetic component in it. Certainly skincare is not going to hurt for people who don't have great genes and maybe more prone to stretch marks and stretching. But I have been using both the Body Firm by Revision and the Transform by Elastin. And just kind of alternating the two. And basically, in my mind, what that's doing and what the technology is meant to do is deliver peptides in the skin to really help strengthen that skin. And as things are stretching, help with repair and peptide repair. And if they're, you know, if we're stretching to a point where you're actually getting damage and injury to the skin, helping with the turnover of that to help boost more collagen and elastin. It's something that I plan to continue even after the baby, because I think that's probably the most important time period, is while probably second and third trimester, while you have the most growth. And then afterwards, postpartum, while you're, you know, really trying to work on retraction and make sure that that skin quality returns back to normal. But certainly a lot of the procedures we're going to talk about can be used on body too.
Yeah, absolutely. Yeah.
What about you? What's your favorite body cream?
You know, for a while I was using, just because I felt like it glided so easily, the Body Tightening Concentrate from SkinCeuticals. And I think that that's nice for almost like a temporary plumping, firming effect, but maybe doesn't do so much long term like the ones that you're talking about, like the Elastin one, or the Revision one. I think both of those probably, like you were saying, have the best concentration of peptides. And for the people who are listening, if you're not sure what peptides are, you know, they're little bits of proteins, basically little strings of amino acids, which are the building blocks of proteins, and they send different signals to the body to induce making new collagen, and things like that. Some of the little peptides mimic estrogen, and we know estrogen is a component in the skin that can help keep it elastic and keep the collagen nice and strong. So that's just a little aside on what peptides are when we keep throwing out these words. But I think that the creams that you're talking about, which have the most active ingredients, probably are the ones that would most likely prevent stretch marks, but no guarantee.
Perfect. Well, I'm really excited because we have some participation from our fabulous audience. So thank you for chiming in with your questions. And I'd like to give a shout out to Ellen Elizabeth, Tinker23 Hay, and C Pollock 1 for chiming in for us. And what I'm going to do is we're going to start, and we'll kind of wrap up skincare by answering one of the questions about recommending a moisturizer for nighttime. And then let's transition into our treatments. And we have a lot of questions about Genius RF, which is one of my favorite and one of the newer treatments on the market for skin tightening that's targeted and really specific to that one niche. And so we'll transfer into that topic. But to answer the question about moisturizing for nighttime, Dr. Geddes, what would you recommend?
My favorite moisturizer is Triple Lipid Restore by SkinCeuticals. I love the way it feels. I love the way it smells. I feel like it's just like so luxurious. When my husband tries to use some, I get mad at him. I say, don't take it all, because he tries to get a big glob, and you really only need just a little bit to apply to the skin to make a big difference. That's my favorite, at least right now. What about you?
Well, I love that they put the essential oils of lavender in it because it smells like a nighttime cream.
Oh,
I
wow.
actually just started using it this past week because my mom loves it. And I was like, I've never tried this before. And so it's quite thick and a little bit goes a long way. And it's really just boosted with all those ceramides. So especially if you have sensitive skin or eczema prone skin, I completely agree. This triple lipid based SkinCeuticals would be an amazing choice. When you're thinking about moisturizers at night, though, I would just recommend looking at your skin type because it's going to be really different for everybody. If you're more acne prone, you probably don't need anything quite as heavy. You may not even need a moisturizer at all. So if you're, in your 20s and 30s, maybe early 40s, have good skin, oilier skin, used to be acne prone, certainly doing your nighttime routine might add enough moisture factor to your skin to create good barrier. But as we age, that barrier breaks down. So doing and finding thicker options that are going to be more hydrating, have more barrier protection are important. I love Is Clinical. They have a product called Youth Intensive Repair. And I think this is just great. I think maybe because I'm a little lazy when it comes to skincare, even though this is my baby, this is what I do, but I love multitasking in life, in my skincare, at work. If I can be doing 3 things at once, I'm in heaven. And so I love being busy and I love busy skincare products. And Is Clinical Youth Intensive Repair does this. It really combines the growth factors using copper peptides. It has vitamin C in it. It has the HA boost, so you're getting the hydration. And so if you forget to do your morning and night routine and put that, on, you can sleep well knowing that you're taking care of your skin, with Dr. Geddes' tenets of following those, getting that antioxidant in, getting that growth factor in, and boosting and repairing the skin. So I think that's a really good choice.
Nice.
As well. Well, we're going to comment some on eye creams too, but let's start talking about treatments and procedures in office because I really want to make sure that we touch on some of these devices and differentiate them. We'll start with talking about the Genius RF and what that looks like when you come in for a visit, but we can't really talk about that without talking about Thermage and Ultherapy, some of the original pioneers to skin tightening on the market, because it really utilizes, I think, a combined approach of radio frequency, which we see in Thermage, but also this kind of specified depth of targeted treatments that we see in Ultherapy. And the biggest difference is Genius RF uses that with microneedling technique. And so you're getting, essentially a little tiny pad of tiny needles, 49 little needles to be exact, that stamp into the skin. And at the tip of the needle is the radio frequency energy. And that energy is used to heat up the skin. And really what differentiates Genius from the rest of the products on the market is that it's a controlled heat. The device is what it says it is. It is a Genius. It is actually taking all of the mathematical factors that may change from patient to patient with impedance changes and outputs, measuring it real time and making sure that the energy delivered is within that very narrow threshold that's going to boost elastin and not just damage collagen. And so to me, that is what makes this particular brand of device incredibly unique. I think the other feature is, never forget who's behind the wheel, who's driving here. You can do anything with this machine. And so your results are going to be very directly related to who is driving, how they were trained, and what their comfort level is with your skin. And I know Dr. Geddes-Bruce is one of the experts in Genius RF. This is a topic that we're talking about different things that we were going to share. So I don't want to put you on the spot, but I know you're an expert in this. So what people are asking is, how many treatments do you like to recommend? And what does that look like? Tell us a little bit about numbing and downtime too.
Sure. So again, yeah, I absolutely love the Genius machine. I think it's our best non-invasive form of skin tightening out there, the best you can get without getting a facelift, basically. And what the patient does is they come to the office, we take photos, and then we apply a numbing cream. We have them numb for about an hour, sometimes an hour and a half on the treatment area. If I'm planning on kind of going off course, using a little bit more aggressive settings, certainly in areas that have maybe some fat that I'm actually trying to target, like in the submental area or in the jowls, I'll do some numbing injections with a local anesthetic. And then We wipe off the anesthetic and start the treatment. And it's basically a stamping method. The device is stamped over the area. Different passes are done until the whole area is treated completely. And I vary the settings based on what I would like the effect to be, right? Again, so if there is some fat that I'm trying to target to lose, like under the neck, I might go very deep and really turn the energy up. Whereas if I go up higher in the face, I'll turn it down a little bit. So it's sort of customized to what we're seeing on the patient's skin and what we're trying to target for tightening.
Excellent. Yeah, we just got a response from another viewer saying that it was one of the best things I have done. Love Genius RF and can't wait to do it again later this year. And I completely agree that your number of settings and really just the intensity that you can tolerate is going to be based on a number of your goals. Another question that we got was, can this be done on Asian skin? Does it help with acne scarring? And can it be done off the face, on the neck, and the chest as well? And these are all excellent questions. So thank you, Tinker Hay. Thank you, Vandy Mom 9, for chiming in and asking some, interesting questions that I think are really important to respond to. And for me, I think, again, going back to who is driving is really essential, especially when you have darker skin types, because one of the biggest complications that we see in darker skin types, and sometimes even lighter skin types that, have more, like, if you tan easily, for example, you might be more at risk for hyperpigmentation. If you have melasma, which can be darkening on the cheeks, the upper lip, the forehead, especially seen after pregnancy, you may be more at risk for hyperpigmenting. And so in these settings, it's really important to do lower energy, lower density treatments, and that your physician is really applying the appropriate technique for your skin to manage your goals, but also the risk. And always, whenever we're doing invasive treatments and even our non-invasive treatments that break the skin, there's always a risk of bleeding, bruising, infection, and sometimes discoloration of the skin, such as hyperpigmentation. And who's doing the procedure and how you maintain the results with your products and care for yourself are really going to be the biggest dictating factors for that. So yes, it can be done in Asian skin, but I would recommend seeing a skilled provider such as myself or Dr. Geddes-Bruce so that we can customize the treatment to your skin needs. And I think it's excellent for acne because you are able to get that deeper energy underneath the acne scar to help boost the collagen, lift the scar, but you're also getting the microneedling from above that can help with texture. I'll often pair this with other techniques such as chemical peels. I use the chemical peels in a very distinct manner called TCA cross, and this is using a high concentration of, it can be done with phenol, it can be done, with croton oil blends called header. It can be done with TCA and should not be done at home by any means. It needs to be done by a medical board certified professional. But you can put strong peels into the actual scar to help boost from above and build collagen from that direction as well. And I know Dr. Geddes-Bruce is skilled in that technique too, because we've shared some patients that we've treated for acne scars with a combination of approach with that too. Any comments for darker skin types or treating acne scars, Dr. Geddes?
So for darker skin types, I completely agree. I think that we have to make sure the patients understand that the risks involved with it and that you can mitigate those risks by seeing somebody who is professionally trained. Board certified dermatologists, we spent 3-4 years, some of us, since we did fellowships, studying the skin, the layers of the skin, how deep things are, where exactly the energy should go. So it's not just like blindly using a machine. There's an art to it, and that makes us able to treat different parts of the skin because we know how deep it is. It makes us able to treat darker skin types that have those inherent risks to get more side effects, like you were saying. And I agree, acne scarring is so difficult sometimes. It's really often takes a combination of treatments, many treatments over and over, but this is just one of our different tools that can really provide a good difference. And like you're right in that you can treat active acne at the same time. A lot of our lasers and other devices have so much heat associated with them that they cause some flaring. For some reason, the radiofrequency microneedling, you can run it over active acne and it can actually make the acne better. I thought that's pretty interesting, and I've seen that clinically, and it's a good way to start treatment for scarring for those patients who are super eager to get going on that part.
Oh, that's an excellent point. Thank you for sharing that. I think, the art of the Genius RF is exactly that. It makes it brilliant, but also can make it confusing in terms of knowing what to ask for, because we can really utilize it for more low downtime, rejuvenating settings. And that's going to be great for somebody in their 20s or 30s. And with that approach, I do like to combine the face, the neck, the chest, and you're going to be pink for a couple days. You might be a little bit dry. It always takes longer for the neck and the chest to heal than the face, because you don't have as many sebaceous glands and stem cells helping out with repair in your neck and your chest areas as you do your face. However, the Genius RF can be customized for more aggressive treatments. So if you're coming in your 40s, your 50s, your 60s, and need a little bit more of a boost, and you really need to turn that elastin and collagen back on, I'll often pair it and layer it with other non-ablative devices. So we're treating the skin like a layer cake, and we're getting those deeper layers with that Genius RF, and then adding on top with something that's going to help more with pigment and skin texture and skin turnover. In that setting, you really do need more of the numbing blocks, the numbing cream. We even offer laughing gas now for our patients to really help with comfort in office for some of these treatments where we're doing a combined approach, or they might be a little harder to tolerate. Unfortunately, as much as we want to move away from the tenet that beauty is pain, there's a lot of painful things that we offer. And one of the roles that Dr. Geddes and I have is making that as comfortable as possible. And, through the environment, through our team, through just small little things that you do beforehand, really minimizing any discomfort for anything that we have to offer. And that's an art of its own. We have another question about vitamin C's and how you pick them, and comparing Skin Better Science Alto with SkinCeuticals CE Ferulic. Let's take the scenario of you are doing a RF microneedling treatment. You're really concerned about skin tightening and boosting. What vitamin C would you pick? Dr. Geddes, I know you're an expert actually in both and love Skin Better Science. So I think, and you use CE Ferulic. So I actually think this would be a really good question for you in terms of how do you weigh the two?
I
when do
do
you
like
choose
them
one
both.
over the other?
I do like them both. Sometimes a little bit back to sort of one of my bridge points is, if someone is acne prone, besides myself, I'm acne prone, but in general, I'll ask them if they have acne prone skin or they look super oily, then I will go away from the CE Ferulic. Sometimes I think of CE Ferulic for a little bit of an older crowd, a little bit of drier skin, but anybody of any age can use it. Alto's lovely as well. I think it does a really good job with sort of pigmentation. I've seen some lovely PIH resolve with Alto and things like that. So I'll kind of look at the patient's skin overall and pick base that way. What about you?
Yeah, so I think it's interesting in the context of post-treatment. I love CE Ferulic because there really isn't a product that has been studied as aggressively as that product. And I feel very comfortable using it post-procedure, as long as people aren't acne prone, because I do see a lot of people flare with that vitamin E component. If somebody is acne prone or using another vitamin C, I think the other most important thing about skincare is, first, protect your skin from the sun. Two, use it. So if you don't like it, you don't like the texture, you don't like the smell, it doesn't matter how good the product is, you need to love your routine. And so I think the aesthetic component is a huge part of really picking out a custom skincare plan for you. And this is something too, it's really hard to give straight advice of what is the best product. It really isn't about what we think the best product is. It's what is the best product for your skin. And this is something that both Dr. Geddes and I review at length when we see our first patients. We see you for consultation, we look over your skin, and we talk about not only what you're doing at home, but what our plan is for that upcoming year in terms of treatment protocols. So come in and see us if you have questions and if these don't answer your concerns specifically. But I think Alto is beautiful packaging. It comes in this beautiful pink bottle, rose gold. It's irresistible, and so it's easy to fall into that temptation. And it's a nice vitamin C. I believe it has the THG ingredient in it too, right? It's not an L-ascorbic acid lotion base, so it's not going to sting or burn, which is really nice. So if you have drier skin and you're acne prone, Alto might be a better choice than CE Ferulic. But CE Ferulic has that serum droplet, which is just a ritual for a lot of people. does have a little bit of an odor and will spill if you are not careful with that cap. It also needs to be used within 3 to 6 months because that L-ascorbic acid can oxidize over time. So if you're not great with skincare, it's probably not the product for you, but it is a beautiful, beautiful product. But to reiterate, going back to the Genius RF, it absolutely can be done on face, neck, and chest. Just be mindful of who you're getting those treatments with. So let's take a step back and talk a little bit about how the technology works, and let's compare it to Thermage and Ultherapy. Tinker Hay, I'm giving you another shout out here. Gold star plus for keeping us engaged and on track here. So thank you. And also for our viewer, Rose Yash, I hope that commentary between Skin Better and CE Frulic was helpful for you in picking the best product for you. But if not, come in and see us. But taking a step back in terms of technology, again, Ultherapy and Thermage are those tenants, those first companies that really, broke that threshold of skin tightening and bringing us products that will address our needs for boosting collagen in the skin. And Thermage uses radio frequency. It is bulk heating. I do not numb for my Thermage patients. Do you numb for your Thermage?
No.
Mm-hmm.
I think that it's important that you have that feedback because you need to make sure that you're delivering the appropriate amount of energy, but not too much because you don't want to create any kind of side effects like which would be very rare, but like a burn. So you need to be able to have the patient feel what's going on.
Yes, so feedback is really, really essential. And it's because that bulk heating is delivered almost like a ball into the skin. Trying to get into the video here and just going deep, and we're targeting that area basically in the deep dermis that's going to boost your collagen and elastin. And if it goes too deep, it's going down towards muscle, which is very, very painful. And so we need to know that. So it shouldn't be crazy painful, but it does hurt because of the continuous heating that you do build up. But we're correlating the depth and comfort to get that ideal response with your collagen. Ultherapy. I love Ultherapy because I think it was a game changer when it was introduced by giving us direct visualization of where we're targeting in the skin.
Yeah.
How do you compare Ultherapy to our other options that we have available now, Dr. Geddes?
So pre-Genius, Ulthera would be kind of the thing that I would go to unless I was on a specific area like the eyelids. I like Thermage there. And a few other areas like on the body. Sometimes I feel Thermage is a little bit easier. That bulk heating is good for, say, the thighs or the abdomen. With Ulthera, where we can control the depth of the energy, how deep it goes, and you can really tailor it to what the patient needs. That was sort of my go-to before the radiofrequency microneedling. And now I've just switched sides and I like that the best.
Yeah, there's a lot to offer. We just had another question about what is offered where and what pricing looks like. And just as a reminder for people who might have chimed in late or missed the intro, but my name is Dr. Heidi Prather. I'm at the main office on Bee Caves Road in Westlake. And that's really nice because we really house almost every device that we offer there. So without question, we usually have it at that location. So we do have the Ultherapy, Thermage, and the Genius RF devices that we're talking about today. Dr. Geddes-Bruce at Far West also has the Genius RF. And what other tightening devices do you have at that location?
Only the Genius RF. We have the Smart Lipo laser too, which can be used in certain areas for tightening. Like when I do liposuction under the chin area, then we do use that laser to do a little bit of tightening of that spot too.
Yes, I love Smart Lipo, and that's a really hot topic. One thing that I want to let you guys know, we would love your comments here. Dr. Geddes and I love chatting with you about what we do, what we love, and what we do every day. And if there are any topics that you want us to come back for and speak of, this is your chance to put it here. We'd be happy to do a talk on cellulite and cellulase, liposuction, or even pregnancy, like what you can use or what's safe, what's not safe. So let us know what your feedback is. But before we move on to a whole nother topic, we got a great question about scars. And I think scars is a huge topic because it really blends that kind of medical and aesthetic world. And there are so many options to use. And when treating scars, it can be variable. I typically don't go to the Genius RF as my first treatment. But it's important to wait until the scar is healed, sutures are out, before you get any treatments. It actually is better to treat sooner than later. There's been a ton of studies on scar remodeling showing that new scars have young collagen that's coming through and a lot of blood vessels trying to navigate the healing of the skin. And when you treat early, you can really actually train the skin to minimize the scar and improve the healing. And I know there's two main lasers that we use, so I'll give it to you, Dr. Geddes. I feel like I'm like taking over.
Okay.
What do you love? What's your laser of choice for scars?
My laser choice for scars, especially fresh scars, a post-surgical scar, like it sounds like this patient's talking about, is the V-beam, the pulse dye laser, which I think we've used forever. It is, you know, tried and true. There's a ton of data on it. It specifically targets those new tiny little blood vessels in the growing tissue. And it makes a big difference in getting rid of the redness and affecting the texture of it.
Yes. And I think once you treat for redness, and same goes with stretch marks, they act like a scar when they're red. Oh, they respond beautifully. Once you wait for them to heal and fade out and that scar of the stretch mark is etched in, much more challenging to address. And then we want to move to more ablative fractionated treatments like our CO2 laser, our Fraxel laser, to really help with the skin texture. So coming sooner than later is the endpoint. And as we kind of, you know, there's a lot of tangential talk here, so I apologize if it's a little circular. But we got another question about pricing. And so how are, you know, the lasers priced? I think that's a really, really important thing to look at. Everything is customized based on the treatment area. So how big of an area are we treating? We often have a ton of packages and discounts to really to take care of people who are wanting to do more treatments and really invest. When you're thinking about doing a Genius RF treatment, the question is, what is your goal and what is your downtime? And those two things are really going to be interconnected, because if you want, you know, and we're all perfectionists at the end, so that becomes where the magic 8 ball has to come into play in terms of, you know, what is that stopping point of when you will be happy. But realistic expectations are helpful. Planning 2 to 3 treatments of the Genius RF, I find people end up very, very happy with the results, and oftentimes even with one treatment. But it really depends on where your skin is to start and where you're going. The Genius RF treatments start at $1,500, and we do add in very, very small fees if you're doing anything like laughing gas. We do not charge for numbing. And if you're doing a package, there are generally discounts if you're wanting to do more than one treatment. The area that we include for the Genius RF is quite extensive, and so we can customize that area, but in standard, it's going to include the face and the neck. But where that can change is it's really about the total energy that is used. And so sometimes we can concentrate that energy in a smaller area depending on if you have more downtime and need more of a response. And so the biggest part, and I think the longest visit, the most important visit, is really that meet and greet, you know, getting to know your doctor and getting to know your goals, again, what you're doing at home to maintain your skin and protect your skin, and where you want to be in 6 months, in 5 years. And we will help guide you and create that 3-step plan and keep you on that road. And so there's a lot of things that go into it. Dr. Geddes, any comments on making a skin tightening plan for our viewers out there?
No, I completely agree. On the get to know your doctor, come talk to us. You really need an assessment. I think that a lot of patients come in and they're really hoping that we can fix everything with one treatment, one device, one time. And a lot of times that's a little bit unrealistic. We can assess you and decide if really your goals are more in line with undergoing surgery, or if we've got devices that can provide the kind of results that you are hoping for.
Yeah. We have another question about, just to follow up on the scars. What are your thoughts on silicone gel strips? Do you think they work or help prevent the scar from building up, which I'm assuming might be like becoming hypertrophic based on the question? Any thoughts on that?
Yeah, I think there's definitely good data that silicone works. It changes the oxygen tension around the scar and prevents it from becoming hypertrophic or enlarged. So I recommend them routinely. What about you?
Yeah, I like them especially for early scars going out of surgery. I know our plastic surgeons use them routinely as a mandatory part of their surgical post-op routine. And so I think early introduction is helpful. I'm not sure how helpful they are, you know, a year out, but they certainly will help reduce redness early on and help with that texture. And so I think that can be an easy thing for you to do at home. Again, there's a broad spectrum of silicone strips that you can get at CVS, or you know, you can get medical grade ones that can cost over $100 that are reusable that you wash. And so that's where it becomes a little confusing on what to get. But again, you know, using something consistently is the most important step to start. And, you know, once you do the V-beam laser, Fraxel, again, can be another option. And Fraxel is a non-ablative laser that really, again, depending on the office and the devices that are available, we can use non-ablatively with low downtime with more treatments over scars to help that collagen smooth out, or go more aggressively with the Fraxel CO2. It has a lot more downtime, a lot more pain, but generally a little bit more aggressive in terms of response. All right, so in terms of questions, we have another great question about consultations. Are they mandatory? What do you like to do for your office, Dr. Geddes?
So we do have a consultant at our office, and she is lovely. She's brilliant. She does very good job seeing the patients, and she brings me right in the room if there's any questions. She's complimentary, so if you'd like to go in and see someone, she's there first step. If you'd like to see me, I'm happy to see you as well. I love to see my patients. I definitely like to see them before we put numbing on, so that way I can make sure that our goals are aligned, that they're a good candidate for the treatment that they're about to get. That's what we do over at the Far West office. What about you? Do you like to see people before they schedule their procedure or have their procedure on the books? Are you okay trusting the consultants? And
you know, it's tough because, you know, I think it's really depends on the patient. And so you can absolutely book without a consultation. And that's part of the reason that we do these engaging, you know, webinars and everything, so that you can make a better decision and decide if you want to sit with one of our consultants, who are excellent. They are not medical professionals, so they're not there to treat you. However, they are personally educated by the physicians at our office, and we treat them. They have our cell phones, they call us with questions, and they're incredibly knowledgeable, and they spend about an hour with you going over before and afters and making sure that you understand a lot of these questions, like what the downtime is, what is the cost, you know, what are the best deals that we can get you. And if they don't know, they call us or bring us into the office so that we can add to the plan and accommodate whatever is needed for you. And so, you know, ultimately getting the best results and making sure that you're in the best hands with the best plan is everyone's goal. So use the consultants. They are a huge asset. When I have patients that come in for procedures, if I haven't seen them before, I'll usually have my nurse or my medical assistant call you just to make sure that we're on the same page, make sure that no pre-medication is necessary, that you understand the downtime and the investment that you make when you do add in the appropriate skincare, and just understand that that is a part of the plan. And that can be very helpful. I also build in time when you come in to numb. We'll still put the numbing on you before you see me, just so you don't lose any numbing time, so you're comfortable. But before I do any procedures, I always sit down, talk to you, look at your photos with you, make sure that you understand the procedure and that it is the right procedure for you. And I've had a number of people come in for procedures, and we just change it to, you know, if it's not the best fit, we switch it and pick the one. And because you've already got the laser time scheduled and the numbing on, unless it's just not possible, just kind of make that switch real time.
yeah.
So let me look through as we wrap up. We have 7 more minutes left, and we have some really, really great questions. And I see some of my fabulous people. So thank you for being involved and sending in questions. But in terms of, are we open? That's huge. And I think this is worth emphasizing, that the Texas Medical Board is allowing offices to open up for aesthetics procedures. We are opening kind of softly this week, so you can get in to see both Dr. Geddes and I. And we're officially opening more kind of full-time next week. And we have a lot of safety things in place for our patients just to ensure that we're being very mindful and respectful of the current settings. And we don't want any of our staff, any of our patients feeling at risk or, worse, getting sick right now with everything that's going on. And so we ask that if you've had any contacts that you wait, 2 weeks. So we know that you're not shedding virus and you're not sick. We're screening everyone who comes into the door, including staff. We're taking staff's temperature every day. And depending on the setting that you're in, your temperature may be taken as a patient coming in as well. We're asking all patients to wear masks in the office since it is a public area, and maintaining 6 feet social distancing, and have plexiglass up between our front desks and the patients. So when you check in, and everybody has the option to wait in the car if there isn't a room immediately available for you, we'll just text you or come out and grab you so that you can come in and you don't have to use the waiting room. But most of our waiting rooms are very, very spacious, so we're able to accommodate distancing in that setting too. And so that's a very good question. But yeah, Westlake is back right now to take care of your needs. And so if you need anything, please don't hesitate to reach out. And absolutely. And one of the things I have come up too is telehealth consults. So we're available for you to come in person if you want a consult with one of the physicians, myself and Dr. Geddes included. Or telehealth is something that we have been using. Dr. Geddes, is that something you're going to continue to offer for your patients?
Yes, I have about 5 slots a day for the people who don't feel comfortable leaving, or maybe they are a little bit, they're elderly, they're over 65, or a lot of people have, gone back to their parents' house or traveled or something. They're away, and telehealth is very convenient for them. They seem to really like it, so I'm going to keep offering it as long as we are able to.
Yeah, I think it's been a game changer, I think, for medicine as a whole. And I know even for my parents who are a little bit older, and they have noticed that when they go get prescriptions now, they're not waiting in busy lines and waiting hours, that there's more refined processes to get the medicine out. My dad was sick over the past week, and thankfully it wasn't coronavirus or anything, but his doctor called him, and it was just so personal. And I'd like to think that maybe telehealth is bringing some, personal connection back to the doctor-patient relationship, so that it does feel a little bit more like you can just reach out and call us and that we're there for you. And so I think even on the aesthetic version that I've had, while we've all been home, a number of people reach out through our telehealth platform just for consults with me to talk exactly this. What should I be using on my skin? I'm interested in a procedure. What should I do? And I realized that, a lot of people probably don't have the opportunity to come in just to talk with limiting schedules. And I think the telehealth is going to be a huge asset for us to continue, even from a cosmetic perspective. And so I haven't figured out how I'm going to put that in the schedule. If you guys have any feedback on when you would like to see Dr. Geddes and I offer telehealth consults, or cosmetic over the phone access in our schedules, let me know. A lot of the recs have been, first thing in the morning, over lunch, or at the end of the day. But I think that end of the day spot might be a really nice opportunity to open up some telehealth opportunities for people to reach out if they can't make it into the office.
Yeah, I love that idea.
Yeah. Well, if we have any other questions, please chime in. And yes, so to emphasize, the consultants are always free, so you can always book with them. And generally, Dr. Geddes, do you charge for consults with you?
It depends. If I'm seeing a patient for a medical issue and they've got a cosmetic question, absolutely not. I just throw that on, no problem, because I feel it's kind of taking care of the whole patient. If they're wanting to block a significant part of time to just sit and discuss and come up with a skincare regimen, then we do have a charge. I think it's $100.
Yeah. So generally when booking with the physician in the office, because we're blocking time on the schedule, what we do is we do charge consult fee with physicians, but it's really more of a deposit to make sure that you show up, and that money is used towards any future procedures or products. And so it's really not a payment, just to make it as easy as possible. Right now, telehealth cosmetic consults are free, and we're currently not charging for that. I'm not sure if that will change and become a deposit type situation too, but we're always open to your feedback. We're here for you. And so if you have any strong preferences either way on what you think works best, please, let us know. You can always email our staff and our front desk.